Now that what I was saying, you see the peritoneal covering, the peritoneum. So the whole abdomen is covered with the peritoneum, and all the viscera, when you are reading embryology and the development of the organs, and you see that everything is small bud-like structure with small protrusion, a tube-like structure that invaginates the peritoneal. Now, see, this is one thing I was just trying to say. I would rather say it's translucent, it's not transparent. Okay. This is the peritoneum. Now, this is the kidney that has been sliced into two halves. Now, you can see the inner. Okay. Now, what's happening now? How would you identify? See the structures at the hilum, the vein, artery. Now you feel it. The vein is thin walled, the artery is thick walled, and the ureter coming. VU, VAU, भाव. एक कुत्ते का भाव कितना है? It is like that. Okay, भाव. This is the vein, artery, and this is the ureter. So, in your table, in your practical table, in gross anatomy, the 2 kidneys will be there, or might be 4 kidneys, but 2 will be there. Right and left will be there. But you please identify. You take the kidney, you are not in a hurry. Even the examiner is not in a hurry. You just take a split of a second, you see the thin walled vein that goes anteriorly. Then artery is there. Then the ureter is there. Okay. One thing is that now the clinical part of it. See, this ureter in the pelvis of the kidney, calyces of the kidney, in the hilum, there might be a large calculus, kidney stone, leading to some obstruction, leading to hydronephrotic changes in the kidney. This is one thing. And so, for the approach of pyelotomy, taking out the kidney stones, is from the posterior aspect. The posterior aspect, not from the anterior aspect. It is the procedure that you don't injure the major vessels. In previous days, when I used to do some operations on the kidney, so kidney stone, renal stone, I had to approach from the big incision, but nowadays you are having small incision and putting an endoscope. But you can visualize and the structure, plus you are having your radiographs. That is a very essential for any pathology of the kidney or the ureter or the bladder to do an IVU, Intravenous Urography. It's a dye that is put intravenously, and 5 minutes. First of all, a plain radiograph will be taken. That is a control. Then you push the dye, and immediately 5 minutes, 15 minutes, 30 minutes, 40 minutes, 1 hour, 2 hours, 3 hours, like this, the dye passes through, and you take pictures, like this. You will get a radiograph of this type of you see the partition. এই বলতো যে বড় কিডনির যে রেডিওগ্রাফটা আছে ওই প্যাকেটটা নিয়ে আমি দেখাচ্ছি। নাও naturally you make an incision, laparoscopy, then you take out the stones. If it is small nephrolith, small kidney renal stones, multiple, there are some medicines in Ayurveda and there are some alkali that you take a trial for 1 or 2 nephrolith is there, then it washes off with your drinking water and this. Now one thing is that, see, renal stones are on the rise because of different types of foods, fast foods and this thing even, but not taking a sufficient water intake. Actually, all of us, not you only, in myself also, we are dehydrated actually. Dehydration occurs in winter. Don't think summer heat compels you to drink water. You feel thirsty, you feel pipasha paay. So you go on drinking. But try to avoid when you are on the move, you take a bottle. I would suggest you're carrying such a big bag, you please take a small glass with you. It might be 100 ml glass. Uska saath le lo. You pour the water from your bottle and drink. That's why in Indian marriages, there is a thing that you're gifting big glasses, big thali, all these are given. A jug or a brass. But nowadays, those things have become so small and big IFB Bosch front-loading washing machine. A big micro oven. At least 20 kebabs can go to reheat. 3 packets of biryani goes in. But the glass is come such small. Or after marriage, those things are placed in your kitchen and also your place for the washing machine. But the glass, everything your mom gave, such a big glass. Okay, now those glasses and bucket and everything in brass that is put in the loft for your next generation. अरे आप भोग कर लो, पियो, tell your patient, I tell every patient to drink minimum 3 liters of water. वो अंग्रेज लोग का बात मत कहो. You sip like this. You go, I went to Singapore. There's no water. But every water that is in the toilet or any place, you can drink. That is potable water. Then what I did, I bought a small bottle of mineral water, whatever it is, and I used to drink with that. I fill up, drink. So one cause of minimum, now kidney diseases, kidney related diseases, especially stones, are that the condition that we are drinking, the quantity that is to be drunk, water we are drinking less. Okay, now there are get to it. You know what happens when my female patient come with a kidney stone or some usually UTI, most females, every other female is suffering from UTI because of the anatomy of the vaginal canal, anatomy of the ureter, and anatomy of the organs. Now I ask them, hey, তোর গ্লাসটা কোথায় রে? বিয়ের গ্লাসটা তোর বাবা দিয়েছিল? বললো হ্যাঁ দিয়েছিল। কিন্তু 3 তলাতে রেখে দিয়েছিস? বললো হ্যাঁ। তোর মেয়ে বৌমাকে দিবি বলে? বলছে হ্যাঁ। তুই আগে ভোগ কর, তারপরে তোর বৌমা আর ছেলের বউয়ের কথা ভাববি। You understood what I'm saying? Now, now one thing I tell you, now the ureter, the kidney, see, this is the position. If it is in the dead body, ospi, there will be labeled a dead body dissected part with the kidneys intact. In the viscera table, there will be kidneys in the viscera table. But when you ask for hospice, then it will be like this. So if a label is tied to the artery, this is the vein, there will be tied. And you will be asked, what is this? You write. So please don't make this blunder, vein, artery, ureter. And the pelvis of the ureter. Pelvis of the ureter. Calyces. Now, this you must know. And you will get marks. It will be in your practicals or label and draw a diagram of the kidney. Now these are the things. This is sites of anatomical constriction. List the constriction sites of ureter at the pelvic-ureteric junction, at pelvic brim, at the site of crossing of ureter of the ductus deferens in male, a broad ligament of the uterus in the female, at the oblique passage through the bladder wall, at the opening of the ureter into the bladder. The anatomical constrictions of the ureter are the sites of arrest of urinary stones. This is an important thing. You just go home and draw a picture with the pelvis of the kidney and then the ureter, and you go and sites of constriction. There's constriction sites. At these levels, ureteric stones get lodged and they find, because there's constriction is there. Stone might be less than 1 centimeter stones are expected to come down with the promotion of fluids and different antispasmodic drugs are there and some Ayurvedic preparation. They work. Some beautiful medicines are there. Don't have a dogma. You have to relieve your patient. No, I am an allopathy doctor. I won't prescribe an Ayurvedic molecule. But a physician or doctor of modern medicine, he takes for his own family and himself Ayurveda they take. Don't be a hypocrite. If you give one tablet, you're not giving poison, which has been come through the ages, some 2,000 years ago, since the time of Dhanvantari. So don't be dogmatic. You will see in Facebook some physician, doctor in Kerala, he says bakwas. Even modern doctors like, yes, like, comment, this is this thing. Facebook, it is nice in the Facebook. But myself, I have seen, because what I do is that in the first visit, I see if he is not or she is not, she's the complaint of ureteric stones, pain, in the your renal, the angle, you press, then the root of the ureter and how it is traveling. And that might be in the right iliac fossa with the ureteric stones in the, you see a pain and tenderness on the right iliac fossa. Don't label it as appendicitis. If you have doubt, definitely go for a KUB X-ray. Second, USG must. Third, if USG, that is the ureteric calculus or ascending pyelitis, it can be on the right side. So don't come you are suffering from appendicitis and go and tell him that no, you need an operation, urgent operation. And you do first ultrasound. If you feel, read the report and see the your plate of the USG and try to evaluate with the complaint, and then build up the story. Go for an IVU. It costs around 2,000 rupees. It will give you a clear picture of and it will clear your doubts. And if there is any hydronephrotic changes, major hydronephrotic changes, then you have to suggest, I am giving medicine. If there is no, you have to go for surgery. Nowadays, I don't do laparoscopy because at this age, I don't want to, because I didn't do laparoscopy any day. But I would send it to our institution. Presently, I'm trying to send this type of patient to our college, Santiniketan Medical College. So, because the super specialty facilities, and they will look into the choice. But your guidance as an MBBS, that's what I'm telling you, a good MBBS is a good PG. Your guidance will definitely give confidence in the patient party and the patient. They will come repeatedly to you for an investigation and your opinion. This is one thing. Second thing, তাহলে তোমরা দেখো একটু, you have to touch, feel, অনুভব করো, দেখো, বাস এটাই হচ্ছে তোমাদের মানে আর পরীক্ষার আগে টাইম পাবে কিনা সেটা ঠিক নেই, তখন একবারে মানে you will be running through revision. So whatever you see, these are the very common organs that is asked for. At the most, we see liver, spleen, kidney will be asked. If every alternate guy will be asked. You might be asked for liver, she might be asked for kidney, she might be asked for spleen. So don't get lost. I mean, hariye gelam. And bones, any organ, don't think of intestine or this thing. If you go for these basic organs first, intestine, of course, you have to, if you ask what is the difference between the large intestine, a colon take dhori dilo, the colon. We have the composite of the whole large gut. If you hold it like this, you start from the base, cecum, then you go ascending colon, right colic flexure, left colic flexure, descending colon, pelvic colon, like this. Leave it. Small intestine. You see the mesentery, this thing, and the ends, two ends. That is the iliac end. See, a stomach can be cut over here without the esophagus, and in the pyloric end. Then the sphincters, you see the cardiac end and this sphincter, pyloric sphincter, are different in the muscularity. Pylorus is thick. Okay. Then you go for the duodenum, it's C-shaped. There will be a pancreas, the head of the pancreas. Then it comes duodenum, then the jejunum here, and then the ileum, here ileum. Now, if you see this end and this end, it will be a bit different. Jejunum and ileum is a bit different. And you will be not asked specifically jejunum, ileum specifically. No. You have to know the difference between the small gut and the large gut. The tinea coli. These are your bands, bands like this. Like this. The bands in the your cecum going. Now, what we usually do during surgery of the appendix, we go and pick up the cecum. Sometimes there is mobile, it is mobile, cecum is mobile. So that might come in the pelvis even. But sometimes it is fixed. You know the position of the pelvic appendix, retrocecal appendix, ileal, pre-ileal, post-ileal, this type of the position of the thing. But that is in the, now you pick up this cecum, then you try to hold the tinea, and then you hold the appendix. It might be a retrocecal up to the liver, or the cecum is not placed in the right iliac fossa. It might be in the just below the liver. It is a congenital malformation. I'm just giving you this. This won't be coming in this in our specimens. We don't have, but you have to know. Okay. Now, second thing is that you have to please see this specimen. If you answer well, at least you hold it in anatomical position and answer well, you will question what is the anterior relation, what is the posterior relation, why is the right kidney below than the left kidney, the upper pole is related to the suprarenal gland. It's simple question to ask. And now these exams are in groups of 5 or 3 or whatever. Whoever comes first, or do to. But don't always put in your mind, I'll go and in group I'll keep shut. No. Amongst your 5 candidates, what they will ask you, I ask you what is the anatomical position. Then I will ask you what is the relations of the anterior relation, the posterior relation of the kidney. I'll ask you the location of the. I have questions, 5 questions. It will take some seconds. So don't think amar bondhu bole dilo, amio hat chhada number peye gelam. Don't be in a thought that 3 groups or 2 in a group you will be asked. You might be alone, and you will be alone. Prepare that when you are answering viva, you will be alone. কারণ ওটা গ্রুপ নিয়ে না বিপদ এটা মাথায় ঢুকে আছে, কারণ 4টে ব্যাচ, তোমরা 4th ব্যাচ। দাদারা বলছিল এরকম আলোচনা, কিন্তু চিন্তা নেই, 4 জন করে হবে, একটা এদিক ওদিক হয়ে যাবে। ডোন্ট টেক লাইফ লাইক দিস। এদিক ওদিক করে কোনো কাজ হয় না, স্পেশালি ডাক্তারি। তোমাকে আমি বলেছি তোমাদের, তাতেও তোমাদের এখনো 2 মাস আছে, যাই থাকুক। I'll count up to the examination day to study, to see. আর যেভাবে রুটিন স্যার করে দিয়েছেন, অভিজিৎ স্যার, you will see and understand how much revision he's given to you people. You have attended classes. I have no obligation against you that no, you have not attended classes. Attendance is there. Okay, in a 45 minutes lecture, your 15 minutes, I am very positive thinker. 15 minutes went into your thought, projection, teach us what is saying. And I say 30 minutes you didn't listen, didn't hear, didn't concentrate, or did some other activity. Don't panic. Now is the time you have to concentrate. Whatever you are given, please say, just see, ekbar kore dekho. Or don't hunt for books and your download and this thing. Don't waste time. Whatever book you have been reading for last 1 year, you please concentrate on them. Draw diagrams, draw, label them. Like kidney, ajkei kidney shesh korbe tomra. Kidney, ureter, bladder, you finish it today when you go home in the evening. Now you see this specimen and just draw diagrams, anterior relation, posterior relation, all these organs over here. Some part in the left, the pancreas tail. The spleen is here, spleen is related. The stomach is the big portion that comes into the left hypochondrium, right hypochondrium, epigastrium. All these relation, and you see the left side, the kidney is related. Even the right side, the kidney is related. You study in that way, just draw a diagram. Don't write so much. If you draw 10 pictures of the KUB, kidney, ureter, bladder, if you draw 5 pictures with relations, 15 marks question, then you will definitely get 12. You have to identify, and the practicals, your time, you will get marks more. So please concentrate.